we're going to go and get everything out of Janine's car that she brings to a birth. So let's see, this is the birth car.
I usually just come in with this one first, because if they're in early labour, then I don't want to unpack my whole car and then have to repack it and run away again.
Yes.
So...
And usually what I've seen is when the second midwife arrives, she comes and gets everything out of your car.
Should we bring everything in now?
Yeah.
Okay.
What do you want me to take?
Maybe just the oxygen bottle.
Yeah. Awesome.
And I will grab... And there's things I leave in here like the birth stool.
Yeah. Because you don't always need that.
No, I don't always need it. And also Kate... and the birth sling, unless someone's actually requested it, I leave it in here. Yeah. Because it's not something you want to learn how to do when you're in labour.
Yes, yeah.
But Kate gave me this cat stool.
Yes.
So I don't hurt my knees. But that all stays in here unless I feel like the baby needs some help with direction around the curve.
Yeah.
So that all stays in here. And this is my suture box again.
Stays in the car.
In here unless we really need it. I have equipment to suture if I need to.
And that's an urn. That's an urn. The family doesn't have something to heat up water to keep topping up the pool.
Exactly. Yeah. So I'll just shut that. And the women usually have their folder.
Yep.
So I
that's
left here at the 37-week visit.
And that's the folder of notes.
The notes.
Yeah. And that's clinic notes that you have done during the antenatal visits that has a record of everything, all her medical history.
Yeah. From the first conversation to all her bloods, her ultrasounds if she chooses to have them. Every communication that we've had.
And past birth, if you've done her past birth with her.
All the previous notes will be in there too.
Yeah, or any notes that she's requested from another care provider.
Yeah. So usually I set up that oxygen bottle away from where she can't see.
Yes,
but very close to the birth space.
Yeah.
And I usually just hide it in a corner somewhere.
Yeah.
And I usually have my little, it's in the car, haven't brought it in.
Yeah.
My drug bag as well, so we probably should go get that.
So Janine, the other midwives all say yours is the kit of all kits.
Oh, do they? Yeah. Like, got to be prepared.
So let's have it.
Okay.
What do you bring?
Well, first of all, when I first go into a birth, a woman's birthing home, I run in with this basket first.
Yeah.
Or run or walk, depends how many noises are coming from the house. And so I don't have to unpack everything and pack it back in my car, which I've done.
Yes.
So this one has my Doppler.
Yeah.
It actually has 2 Dopplers because I have dropped a Doppler in the pool before.
Yeah.
And so I always come prepared with 2 now.
Yeah.
Because once these Dopplers go into the pool, they're never coming out.
Yeah.
Well, they come out, but they don't work.
And so for families to understand, this is how you monitor the baby's heart rate during antenatal sessions and during the labour itself.
That's correct.
Yeah.
And so Dr. Kirsten Small says this is just as effective, if not better, than continuous monitoring for the well-being of babies in normal births and pregnancies.
Yeah.
Okay.
And there is research around that.
There's lots of research.
Yes.
Dr. Kirsten Small, go check it out.
Yeah.
I bring a pulse oximeter, which gives us oxygen and the mum's heart rate, but also this can swap over to the baby as well. I have another attachment for babies, which is over in this one. But I now have 2 of these, one specific for babies, one specific for mums.
Yeah.
But I only use this because this is a very hospital-y kind of equipment. It's beeping and it's flashing and it makes noises, and I don't feel like that's always necessary in a home birth. I usually just use my hands.
Yes,
But if I can't count with my own fingers because it's going so fast, this is where this is accurate.
Yeah.
And then I can show the woman too, look, we're going really fast here. Something's not quite right. You're either parched, dehydrated, or something else is, your body's trying to tell me something.
Yeah.
So I only bring it out very occasionally.
Yeah.
I have doTERRA hand rub. Yeah. A Pinards, which is old school, but this is a good way of finding out if the baby is breech or cephalic, because babies don't have heart rates in their butts.
Yeah.
Okay. Some women only let me use this.
Yeah.
So you have to be upskilled in knowing how to listen to baby's heart rate with this. A tourniquet for very emergent reasons in this bag. Yeah. A head torch so that Kate doesn't have to hold the torch for me. So if I need to do suturing, I'll put my head torch on.
And by suturing, you mean that's for any grazes or tears that have happened during the birth?
That's right. It's very rare that I would suture a graze, but usually for tears, or if the vulva's anatomy is not aligning, or if it's bleeding or gaping. A torch, because we often work in the dark, and I like to keep it dark for all the melatonin and safety aspects. But I also need, my eyes aren't as good as they used to be, girl. So I need a torch to see. So that's in there. And then in the rest of this basket, I have a thermometer.
And just by the way, that is no different to how a woman would be monitored, like in midwifery group practice in a hospital or in a public hospital.
No.
It's exactly the same.
Plus blood, a sphygmo, so blood pressure cuff.
And you're doing all the same maternal checks, permission from the mother. You do every single thing to document in their folder so that you can see the history of what's happening during, obviously, the pregnancy and during the birth.
Heart rate, temperature, blood pressure, fetal heart rate. Checking her pad, see what's on her pad. Listening to her noises. Listening to her uterine activity. How often. Her behaviour. This is just a quick bag. So if I don't bring this in and she's going like the wind bullseye of things that I can just quickly grab. So there's an amni hook in there, so to break waters if I really needed to. A sterile sponge. Ondansetron in case they vomit. Cannulas. This is just my quick grab bag. This isn't my cannula bag. Swabs. If they break their waters and it's early and we need to swab. A suction catheter. Funnily enough, my easy air lozenges, because women get stuffy noses in labour and they can't breathe through their nose, so I pull them out an easy air lozenger and they're clear. It's great.
Same way, I use nasal sprays and things
so
too.
Good. So good. Quick cannulas to really quickly cannulate if I needed to, and gloves. So they're all just my quick grab. Vomit bags. Rebozo or a woven wrap if we're being culturally sensitive in our language. Magnesium to feed the muscle. Because some women just drink water and it's not enough sometimes.
I ordered some of that after I saw that you had that. I was like, oh, Janine.
It works a treat.
It does work a treat.
A birth mirror to have a look underneath the water. And it's really just so we're prepared. Checking, you know, how quickly the baby's coming, if the baby's coming, the water's intact, being 2 steps ahead of where we probably don't need to be, but just in case. Is there cord there?
Yes.
You know? And not having to get the woman to move. You know, so she can stay undisturbed. Gel to use the Doppler with. Urine sticks to check urine if we are suspicious if the woman has got protein in the urine, if she's got blood pressure formulating, if she's got glucose in the urine, if she has got ketones, if she's dehydrated, how much water has she drank, how dehydrated is she. So that one strip of wee
can give you a lot of information.
Can give me a lot of information. One of the best nursing tricks I ever learned, actually, in nursing. So essential oils. Blissful herb tinctures and herbs. So a lot of these things are a natural remedy before we would use pharmaceutical drugs. So no bleed tincture, the postnatal cramp tincture, birth boost. All things that you can get in your birth box from Blissful Herbs.
Which are very effective.
They're very effective, but they're first line natural management that we've been using for centuries. Centuries. And obviously we will upscale in a minute, but heaps of lube. Because nobody wants to dry vaginal exam, right? If we need to do one. No one needs that. Bigger cuff for women who are a larger size. Okay. Always talked about childhood vaccines. So I have a little childhood vaccine book. And a wheel. A pregnancy wheel to work out gestations. If someone calls me in the car and goes, oh, my waters are broken and I'm, you know, blah, 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 I can quickly figure out how many weeks she is there and then. All right, so that's my run-in bag. And that gets restocked every single time I come back from a birth. And often through the week because I'm constantly doing things. This is my birth kit that I literally move into your house with.
Yeah.
So I know where everything is, and if you're a second midwife, usually you know where everything is.
Yeah.
I have automatic blood pressure so that if we are in something like a PPH, I can quickly strap this on.
Yeah.
Then Kate's doing another job. And we can see the numbers.
Yeah.
So the woman can see the numbers.
Yeah. And so for people that don't understand the medical jargon, that's PPH is if a woman is bleeding more than what you would like to normally see after they've had their baby.
Yeah.
Yeah.
Yep. I have a catheter kit.
Yeah.
I have catheter bags, indwelling catheters.
Yeah.
And this is my catheter bag.
And that's for women that need help doing a wee?
Help doing a wee or in postpartum hemorrhage management.
Yeah.
And all of this stuff is for a postpartum hemorrhage and a catheter as well. There's a speculum in there.
Yeah.
If I can't see the back of a tear, I can put a speculum in. I have IV fluids and an IV drip.
Yeah.
Again, for postpartum hemorrhage, this is my postpartum hemorrhage kit.
Yeah.
So everything that you would need like that, instead of having to go through all of this, we just grab that out and it's all in there ready to go.
How does this equipment differ to what you might find stacked in the shelves at the hospital?
Well, in the hospital shelves, they're everywhere, aren't they? And you have to go bar. But this is all here.
But it's exactly the same stuff.
Exactly the same stuff.
Yeah.
I have a picture of my second born daughter who was a vaginal birth, and that was one of the best things I ever did in my life. So I bring that with me as a memory of how amazing that moment was.
Yeah.
And she's like my little angel that I bring with me.
Yeah.
More catheter bag stuff because, I like to be prepared.
Yeah.
And gloves and fluid and syringes.
Oh, gosh.
IV starter kit, which starts to put the cannula into the woman's hand. So that's all easy access and just reach out stuff. Yeah. Swabs for bleeding, but also if I'm suturing.
Yeah.
But also for warm compress on the vulva. That's what I use them for mostly.
Yes. Yeah.
So with consent, I'll show you in a second. So blueies to put down on the floor, and then Kate loves these. Yeah. They're really expensive and she likes to use them all over the place. I've put her on a one work per woman ban. I've said, stop using them. They're huge, big white pads.
Yeah.
And this is usually what we get the women to sit on when they're about to birth their placenta.
Yeah.
So if you see this come out, it means your baby's on its way.
Yeah.
Because Kate's been on a 1 per woman restriction. These are wipes to clean equipment after at the birth. So usually afterwards, Kate and I are sort of doing stuff in the background, wiping the pool down. Yeah. Extra swabs. Yeah. And that's really, again, for when the baby's coming. So if you're not in the birth pool for some reason, I have a cord clamp, a pair of gloves, swabs, and a little birth pack. They're the main things that we use. Yeah. Okay. That's for the most part. Actually, not even this big one. Yeah. Usually, there's my little ones. So over here's gloves and cord clamps and little sponges. Yeah. So that's the main sponge I'll use because most women's vaginas and vulvas are
very sensitive.
Well, when we're checking, they're not that big. So why would you use all those swabs when you can just use that one as a little gentle check and then that's done. But sometimes we use this for when they're sitting on the birth stool or when they're out of the pool. I get Kate to fill up this with hot water. Yeah. And then we put those in there, and then I've got gloves on, and with her consent, I just put it's sterile, but it's not sterile once I put it on the woman. Hannah Dahlen has done one of the largest studies ever for heat compressed perineum to reduce perineal trauma. Yeah. And it really works. And the women usually go, oh, put it back, put it back.
Yes, they find it very soothing.
Yeah. 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 Some Chlorhex if I'm doing, an indwelling catheter or something. I don't usually pour that over women's vaginas.
And that's to sterilise.
Yeah, if you're doing something invasive. Yes. You don't need to pour that over her vagina to give birth to her baby, though. Yes. Her vagina is really important. Yeah. Has really important microbiome there. So you go and sterilise it. It's not a sterile thing, is it? Yeah. Yeah. So
that's for procedures when you're doing something that's medical.
Yeah. So that they
to keep her safe.
Reduce infection.
Yeah. Yeah.
Yeah. So in here there's pathology bags, an actual adult resus little mask. Yeah. As I said before, there's all like gloves and cord clamps and gel, spare amnicots. There's instructions for breech birth if someone isn't trained. If I've got a second midwife with me who hasn't done a breech course, it's here ready for them to go. But usually if we're at a breech birth that someone actually knows they're having a breech birth, I will consult with someone who feels well educated to back me up as well. So I always call another midwife.
So you've got two experienced women in breech.
Midwives, In here is our maternity pads. Sometimes women don't have them, but these are the best things to put on afterwards. Some knickers, a spare resus bag. If for some reason this one wasn't working, I've got backup. These are the birth registrations and Centrelink papers that we give out when babies are born at home so that women can register their baby's birth and also put in parent leave and things for dads at Centrelink. This is my cannulation and IV little box. So it's got everything in it so I can put a cannula in a woman's hand. And this is my suture, antibiotics, cannulas, all sort of IV stuff in this one. That's those. I have...
Janine, this is a serious bag.
I know. And then I have another little tackle box in the car that's my suture kit. But I could suture with all the stuff in here, but I like to get that one because I know where everything is in there as well. Over here, I usually keep my drug bag and my oxygen together because they're emergency resources and that the second midwife usually comes in. I don't show the woman where that is because that looks clinical and a little bit scary. So I usually put it just close where we are because you don't want to be running and getting it, but we put it somewhere that hopefully she can't eyeball it. And my second midwife, after I've checked it, she'll check it as well. And in here, every time I leave my house, I go and get freezer blocks from the freezer and put my emergency drugs in here.
And the emergency drugs are for
bleeding.
And do you leave those at the home as well? No, you keep them.
Too many hundreds and thousands of dollars I've lost leaving them at someone's house because I always forget about them. So I never leave home without it.
Okay, cool.
This is my drug bag. So other drugs that you don't need to keep refrigerated. Vitamin K, if women choose to give it to their babies. Metoclopramide for nausea and vomiting. What else is in here? Tranexamic acid, which is another bleeding drug that we can do IV after all those other things. If they don't work, this is the bomb. This really, really helps women to stop bleeding. What else is in here? Well, more vitamin K, more needles, and a very special birthstone someone gave me once who had the VBAC too, actually. Then I don't get my postnatal bag until the baby's born. Out of the car. So normally after everyone's settled down, the placenta's been born, everything is nice and calm. Kate's put the birth pool down. I ask Kate to run out, or if I'm ready, I'll go run out and grab my postnatal bag. So this is my little funky bag. So it's got the scales in it, and usually I ask the family to have a muslin wrap. And we hang the babies in the fish scales. So.
And they're so beautiful. They're tucked in like little nuggets.
Like a stalk.
It's so different to the way that they're
not on a cold, hard surface.
No.
And they're usually lifted above their mama.
It's totally different.
A blood sugar machine because...
Like a stalk.
Because some women need their blood sugars checked and some babies need their blood sugars checked.
It's a blood sugar checking
device where you can just do a little blood spot.
For mothers and babies.
Gloves in case I need to check perineums at a postnatal visit. So this is my postnatal bag. This is like I said before, I had a machine for the baby's heart rate as well. So this goes around their little foot. Around their little foot, it plugs into there and it tells me what their oxygen saturation is and what their heart rate is. This is also to check their little eyes in the newborn check that I do. So some people will have their babies checked by a paediatrician in the hospital. Well, all births in hospital will be a paediatric check, but we are qualified to do that check at home. And this is just one of the instruments that I can look in their eyes and just make sure there's a red reflex. I have a cord remover clamp to take their cord off on day 2 to 3 or 4. What else is in here? More vitamin K, blood taking equipment for newborn screening tests. and equipment to take blood from babies if they've got jaundice or something, to send it off to the lab.
Yeah.
Swispers to show people how to clean their baby's belly button.
Yes.
A poo chart to show them what's normal, because if you see black tar coming out of your baby's clean, beautiful pink bottom, you think the world's ending, but it's actually really normal. And how it changes with the milk coming in, and how reassuring that is.
Yeah.
Some light reading material, because women give me stuff to read sometimes.
Yeah.
And chaga for me, that's for me.
Yeah.
To drink, and pregnancy and breastfeeding tea.
Yeah.
Yeah.
Wow. This is the bag of all, like they were right. This is the bag of all bags.
Got to be prepared.
Yes.
Because when you're walking in, you just never know what you're going to need. I didn't do Girl Scouts, but I like to be prepared.
Yes. And behind you here, you've got your folder, which is an example of how you take notes.
Yep.
And every woman that you work with gets their folder at the end that has a copy of all their clinical notes, all their history.
So the first usual meeting, our birth agreement, our interview, at first contact, all the things we talk about, their medical history, their antenatal record, their birth notes, their last visit, their postnatal care, the comprehensive notes that I write every single time we have any contact.
Yeah.
Their bloods and ultrasound results, and then any information that I give them for education is at the back.
Yeah.
So your OMP moves.
Yes.
Vitamin K.
Yeah.
Swish hearing test.
Yeah.
Breastfeeding handouts.
Yeah.
Yeah.
Amazing. Amazing. Janine, you're incredible. I'm so glad that we did this. This is, you've got they're right. This is the ultimate bag.
I didn't show one thing, and this is, I've only ever had to use it once in 25 years. Yeah. A little thing that goes down the baby's throat. So if the bag and mask isn't sealed, this can be a much better, I suppose, resuscitation skill that we can have at home as well. But it's very, very rare. I've only had to use it once, like I said. Yeah. Yeah.
But it's there just in case.
Just in case.
Yeah.
And you don't need it, right?
Thank you so much for showing us everything that you have.
You're welcome.
And it's incredible, Janine. It's unbelievable.